Now, sometimes you're not using zero form. Sometimes you need to apply a wet to dry. Now, a wet to dry dressing is literally, I'm gonna wet my 4x4. I'm gonna wring out the extra water. So now my 4x4 is wet. I'm gonna fold it over whatever wound that I have. Let's say it's here. And then I'm gonna put a dry dressing on top. That is a wet to dry. It's wet on the bottom and dry on top. And then I have to anchor it down, right? Now, sometimes you might need more padding, but I need to now anchor that dressing down, right? So then it becomes this dressing where I have to put it on lockdown. I've got to now dress it so that it stays, right? So now I have to wrap it and I have to anchor it. And then you'd go around or you'd go around the fingers, but that's essentially wet to dry. And you would do wet to dry depending on that wound. If it's a little thicker, if it's a little deeper and if it's got some debris to it, then you want to wet to dry, because when it dries, it's going to stick. And then when you take it off, it's going to take that debris with it. So wet to dry can be really good, but it doesn't discriminate the good tissue with the bad tissue. So wet to dry dressing is really good on a dirty wound, right? On like a wound that's got like a lot of yellowish, it's got lots of black and yellowish types of debris on it. If it's nice and red and granular, you might not want to do a wet to dry, because of the wet it will just take it up. And you can do it, but you have to then, when you take it off, wet it before you take it off, because it'll rip off the good tissue with the bad tissue. So usually if it's good, nice granular tissue, but you need it to stay moist enough, you would do a non-adherent dressing. That's all you would need, a non-adherent dressing. Zero form is a type of non-adherent dressing, but it has like a certain like petroleum blend to it. But a non-adherent dressing would just be as good. And for that, you'd cut it and you'd put the dressing and then you'd put a dry dressing over it. So that's pretty much some of the wound care. But you really want to make sure that you're telling them, this is what I'm doing. I'm putting this on because, I want to make sure it's not. And so you're just having to describe things a little bit at a time. So if someone comes into you and they're fresh post-op and you go and you clean it and you go and you wrap it, and I always show them, listen, some people don't want to look at it, but I always like, listen, I know you don't want to look at it, it looks really gross, but let me tell you, honestly, it looks really good. If it looks bad, I say, listen, I know it looks terrible for you, but I need you to know what it looks like, because I need you to know when it looks good and when it looks bad. And right now, it's full of debris, it's a little dirty, and I need you to pay attention for these signs. I need you to know when things don't feel or look good anymore, right? I might not do that. I might not force them on the first day. I may not force them on the first day, especially the super skittish ones. I won't force them. But if it's right before the weekend and I know I'm not going to see them, I have to force it, because now you're not going to be with me for 2 days. And it's always the therapist's fault. I don't know if you know, they might not sue your ass, but it's always your fault. Right, Sophie? Oh, my therapist didn't tell me. I'm like, okay, here we go. Nobody told you, right? So yeah, you just want to make sure, like, listen, I know you don't want to see it, but here's what I need you to pay attention to. Signs and symptoms of infection. I want to show you that the redness that you see here is normal today. If you start to see that redness spread beyond the borders of the incision, that's not a good sign. That might be a sign of infection. If you see drainage, that's okay. It's okay to drain a little bit, especially if they have a lot of edema. But if you start to drain a lot, right, or you get more swollen, like you're swollen now, I want you to see how swollen you are. But if you get more swollen and more red, that is a sign of a potential infection, right? And people usually be like, oh, but is it pus? It's not necessarily pus. Pus is only determined from a culture. Majority of the time, Your wound is just weeping, right? It's weeping. It's got too much swelling, right? So then it starts to leak out, right? So that's okay. That's why you have dressing, to catch it all, because it's not always blood that's seeping out. It's for people who are really edematous, it's the extra fluid that the body is secreting, right, to that area for healing. Now, the other sign and symptom of infection usually is pain. So the pain, you have a certain amount of pain. What is your level of pain right now? When that pain spreads, that's a sign of infection. So it's redness, it's swelling, it's drainage, right? And the other thing is pain. And the other thing is if they have a fever, right? If you run a low-grade fever, that's also a sign. Now, a lot of times their hands might not feel like, it might not smell so good, but it smells like just stale, right? But when you have an infection in your hand, there's a specific odor to it, and it stinks, and it's a very specific stink. If you smell that, that's a sign of infection, and I need you to call your doctor. You can call us too, but I need you to call your doctor, right? And I'll be able to tell you, oh yeah, I saw it last time, it didn't look like this. So our whole goal when you have a wound is to keep it clean and dry. Don't go swimming, don't soak it, just keep it clean and dry, right? Now you can give instructions to change the dressing once a day, twice a day, depending on that wound, right? It's usually honestly just once a day. When you shower, just wash it with soap and water, as long as it's a simple incision. Now we can go into more complex incisions, and it's a little bit different. But usually it's, don't overdo it. It's just once. If you see it has a ton of drainage, then you're gonna be doing dressing changes twice a day. Dressing changes and cleaning you don't have to overdo it on the cleaning. You might just need to change the dressing so that there's more clean dressing to soak up any fluid or blood or anything like that. But it doesn't mean that you have to pick at it and that you have to, like, quote unquote, scrub it and clean it again. So what you do from the first time you do a wound care thing to the second week to the third week, it's all going to be different. That's why they're coming into you as an expert, so that you can make changes to their wound care needs as they heal.
Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.